KUSI News at 6.
The World Health Organization is warning that the mosquito-borne Zika virus is now spreading explosively, with 3 to 4 million cases of the mosquito-borne illness estimated in the Americas in a 12-month period. Concern, of course, is mounting here in the United States. Some 80% of those infected report they do not even feel ill. The virus, though, is most dangerous to pregnant women and their babies. In areas where the virus has surfaced, there has been an increase in babies born with serious brain damage and abnormally small heads.
The risk really at this point exists only in pregnant women, but it is a very, very severe risk in pregnant women. Having children born with microcephaly can lead to, or fetal loss altogether, but microcephaly can lead to lifelong neurologic problems that can range from mild to very serious.
Now, we're told there are no medications or cures to treat those infected with Zika and no vaccines to prevent the virus, although U.S. officials say clinical trials on a vaccine could begin sometime this year.
This has really hit all of us in the United States rather suddenly, but now the virus has been confirmed to be spreading throughout the Americas. Many people still very unsure what the Zika virus is.
And joining us in studio now to discuss the virus and what it means for all of us, Dr. James Italiano. He's with the Tri-City Medical Center. First of all, Dr. Italiano, I understand from what I read that this virus has been around for some time. Why are we suddenly seeing so many cases in the last year?
It has been around since the 1940s in Africa, and it's now spreading through the Americas, more South America, Brazil, and it's just becoming more prevalent. And one of the thoughts is that it's more linked to microcephaly.
And microcephaly, explain what that is. That's the brain we're talking about.
Correct. That's literally means microcephaly, so smaller brain vault. And with that, the potential for a baby to not develop as well as it should.
How is it spread? Is it spread only through this mosquito bite? Is it we're seeing more transmission rates because there's more of this insect around? How is it transmitted?
It is transmitted. It's not like Ebola. Ebola is person to person. We can get it just talking to each other almost. This is spread by a mosquito. So a mosquito would bite a person, and then it would take that virus and then go and bite another person. So the rise of mosquitoes has been the key issue, what the World Health Organization, I would think, is hoping to help control.
So at this point, it is only a danger to pregnant travel south, who travel to these Central or South American countries, but there is the chance that that mosquito will come north.
I believe so, and I believe there have been some travel restrictions, and they're not so much restrictions as thoughts that someone that's pregnant or thinking of becoming pregnant should not be traveling to Brazil, South America.
Some of the airlines are offering refunds to pregnant women that are flying to those locations.
Now, we're hearing a lot of the cases are coming out of Brazil. It's been really hard hit. They have, I think, that's the single country with the most cases. And with the Summer Olympics in just a couple of months, I think I've heard that some countries are advising or giving their athletes the option not to attend the games in Rio because of this possible threat.
Yeah, definitely. And again, the threat's more towards pregnant women. If a man or a non-pregnant woman gets it, it'll likely cause just fever, maybe a rash, red eyes, and not so much of a life-threatening condition, but it's been more the link to the pregnant women. That's the big issue.
And there is no treatment, right? There's no immunization. There is no treatment after you get it. There really isn't anything you can do.
No vaccines, no antiviral pills. Antibiotics do not work because it's not a bacteria. Things like that will take some time, anywhere from, I would guess, 3 to 10 years to develop.
But like you said, unless you're pregnant or thinking about getting pregnant, it's nothing to really worry about as far as travel goes.
Yeah, definitely.
Yeah, just a virus-like symptom.
But nonetheless, very frightening.
Very. All right.
All right.
Doctor, thank you. Appreciate it.